This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Mon Health Talk for this Monday. Thanks for joining us. I'm Kyle Wiggs. Our guest this morning is Dr. Lisa Flower. She's with Mon Health Primary Care in Fairmont. And Dr. Flower, good morning. Thanks for your time.
Good morning.
We appreciate you coming on. First of all, let's start with the facility in Fairmont and how you ended up there. How are things going there? It's one of the newer facilities in the region.
Yes, it is. I have lived in Fairmont for most of my life, and my partner, Dr. Judy Bonfili, and I have practiced in Fairmont now for 20 years, if I'm counting correctly. And we were in another location off Locust Avenue when we joined Mon Health, and we were looking to expand. Our building was too small at the time, and we moved into this beautiful facility here in Whitehall, and we have another family physician that's joined us since then. And in this building in Whitehall, we actually even have cardiology, OB-GYN, pulmonology, and orthopedics now. And in the building, just a physical therapy place recently opened as well.
All right, so a great partnership. You coming on board with Mon Health. How long has that facility been open now?
We have been here about 5 years, if I'm counting correctly.
Man,
yeah.
Time flies. Doesn't seem like it's that long.
It does. It does.
All right, what's your specialty?
I'm a family practitioner, so I see everyone from birth to end of life.
Okay. And obviously that's a very wide range. Is that is that what makes it attractive to you? Is you get to see folks in all stages of life?
Absolutely. I enjoy the babies, the children, watching them transition to young adults, and taking care of all the family. I have generations of patients, and it just helps to know all the family dynamics, their health problems, everything that's going on when I see them.
All right, our topic today is transitioning from pediatric to adult health care. And obviously you should know all about this because you see the entire range. So what exactly does that mean, transitioning from pediatric to more adult-based health care?
For some patients that have been seeing pediatricians, it can mean that they actually do need to change providers. Pediatricians typically see children until they're around 18, and then they need to transition to an adult primary care provider. So those of us who practice family medicine, it can mean just a shift from the parents being the main point of contact to the young adult being the main point of contact.
Mm-hmm. Okay, so in pediatric care, the focus is on preventative care, right? Vaccines, that type of thing, childhood illnesses, and you shift to more adult, as you mentioned, the individual's the primary contact.
Correct.
Okay, so you have to plan for this, right? There's some thought that goes into moving on from your pediatric health care to getting a physician that hopefully will be with you for, the balance of your life. So what goes into that decision? What goes into the thought process of a patient that's going through this?
The decision, again, if they need to find another provider, that's a big step, and the child young adult needs to become familiar with their new provider. There's so many different things. It's a lot on them. At that phase of life, they're transitioning from school, whether it's homeschooling, high school, wherever they are, into college or a job or the military, and transitioning healthcare from their parents being the main responsible person to them is another big step that we often forget about.
Mm-hmm. Yeah, and a lot of young adults leave home and go to college, or they go into the military. So, again, you kind of have to be prepared for that. And medications, that's a big deal as well when a young adult takes responsibility for making sure their medicines are taken care of and fulfilled. That's a big part of it, isn't it?
Absolutely. And there are some medicines that take a little more planning around, such as attention deficit medicines. Many of them are controlled substances, so they can't be written for extremely long periods of time, and getting refills on them takes a little more of a process to get them.
Mm-hmm.
So, again, these are things, and even acne medicine, a lot of teenagers are on acne medicine, some are on anxiety medicine, birth control. They need to know how to get their medicine, be more in charge of taking it, making sure they, first of all, take it on a regular basis. Second of all, they know how to fill it and when, and the process of getting medicine filled.
Mm-hmm. All right. So when should a person start thinking about this? And I guess it's a joint thing, right, between the parents and the individual. When you got to kind of start thinking on your own. When should this transition start?
Ideally, it should start earlier in their teenage years. Let them start assuming responsibility, whether they're seeing someone as myself that could potentially take care of them through their college years later in life, or even their pediatrician. When you walk into the office, let them check in, let them give their insurance card. You can go back to the provider with them, but mom or dad at some point in the visit should step out. Let the child answer more questions, discuss their health. Give them a little more responsibility with you overseeing it through those teenage years, so it's not such an issue when they become an adult.
Are there some indications or signs that maybe it's not the right time?
Depending on what's going on. I mean, if someone is seriously ill or has a lot of anxiety, your child may not be ready for that. But again, when the doctor's asking questions, let them answer. That it's their body. Encourage them to answer more. The parents can be there to help correct any questioning the child may not feel comfortable answering at times, but let the child talk.
Yeah. Okay. Let's give a couple of scenarios. First, a young person going off to college. They're going to be leaving home and being on their own. What do they need to think of or think about in terms of their health care and managing it a little bit more on their own?
They need to know some of their basics, such as their allergies, any important information of their health that has come up in the past, surgeries, chronic conditions, etc. Immunizations are important. Many colleges require certain immunizations before they go, so they need to make sure their immunizations are up to date. They have a copy of their vaccine records. And again, as we talked about, even medications, know a pharmacy, know where they're going to go and have that medicine filled, and a provider in their area if they're moving.
Mm-hmm.
You may need to set that up ahead of time, help them figure out a clinic that may be covered in their plan.
Mm-hmm. And insurance is crucial. Obviously, the young people need to know about accessing their insurance, whether it's an insurance card or whatever it is, the identification in case there's an emergency or in case you have to make a trip to the urgent care, right? That insurance information, that insurance card is crucial.
Absolutely. And many parents kind of forget about the insurance piece, but that can cost you an arm and a leg in the end if you're not careful. Some insurance plans require you go to certain facilities, or that there's an extra fee if they go to the emergency room for an earache instead of urgent care for something that is more appropriate. And, or again, if you go to the wrong pharmacy with your insurance, you could be paying a lot more. So, unfortunately, in our healthcare system here in the U.S., you need to go over those things about how your insurance works with your child.
What about those enlisting in military service? What are some things that they need to keep in mind?
Be open and honest when they first are registering. Make sure that the military knows all their chronic conditions, whether that be that they've had like an orthopedic surgery or mental health issues. Be open with them. And again, make sure all of their vaccines are up to date. The military will often take care of that. But again, have your vaccine record so they know what all they've had.
If you're, hopefully most people have a support system to lean on, a mother, a father, grandparents, older siblings perhaps. But if you're a young person that's out there kind of on their own, how do you find a doctor? How do you find a place where you fit in and somebody that's right for you? What would your advice be for that?
I would say, first of all, talk to friends, family. If you have family members, if you're totally moving to a new area, you can get online, talk to coworkers, find someone that is reputable and has a good reputation in the area. Mon Health, we have facilities all through the state, and with Vandalia Health even more. You can get online and find one of our providers, set up an appointment, meet the person. If you don't feel comfortable talking to that provider, switch and find someone else that you're more comfortable with. It's very important to be comfortable with your primary care physician.
What about mental health services and resources? If you're a college student, if you're just a young person in general, if you have issues that you need to deal with, again, what's the process there of finding some help?
Yeah, mental health is it's a chronic condition often. Sometimes it can be acute as well, depending, stress can bring on high levels of anxiety, and especially that transition from school to college to workplace to military can cause a lot of stress. So parents need to encourage these young adults, their teenagers, to talk about how they feel, and if they're feeling more anxious, depressed, social anxiety, even suicidal, and how to seek help. First step, usually those people will reach out to a loved one or someone, a family member, a close friend, and then those people need to help point them in the right direction of a provider. First step often is talking to your primary care provider. Again, the family physician, the pediatrician, the family doctor, and then we can help point them to resources, whether that be they need a therapist, a counselor, a psychiatrist to help. And then again, on college campuses, there's usually lots of mental health resources available for them, and letting your child know if you get into an issue that you need mental health care, that this is the number you can call at your college or your workplace.
Mm-hmm. We are
opening that conversation with them, letting them know it's nothing to be embarrassed about, and they can come and have an honest conversation about their mental health care. Yeah,
absolutely. We are with Dr. Lisa Flower, Mon Health Primary Care in Fairmont. This is Mon Health Talk for this Monday. We're going to take a quick break. We've got more as we'll continue the conversation coming up right after this.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Mon Health Talk for this Monday. Thanks for joining us. Our guest, Dr. Lisa Flower with Mon Health Primary Care in Fairmont. First of all, Dr. Flower, how can our listeners reach you at the Fairmont facility?
Our phone number here is 304-368-2422, and they can call and schedule an appointment.
All right, 368-2422. Okay, so if someone's out there listening, we're headed towards late July here. We're in the latter part of July, so there is time before high school starts or college starts, and that young person may be leaving home soon. But families need to take care of this now, right? If the young adults are looking to transition from pediatric to more adult care, what are some things that parents can do with them here the rest of the summer to kind of prepare them for that journey?
They can set up an appointment with a new PCP if they need one, if they're going to be staying in the area, or even if they're going to be coming home a lot. Go ahead and set up someone that is in their local area where their parents still live that they can see every summer when they come back from college. And so to transition from the pediatrician to an adult provider, if they're already seeing someone as myself who can continue seeing them from pediatrics through adulthood, set up an appointment, and we can go over any forms that they might need for college, their workplace, the military. Go ahead and obtain your immunization records so that they have that to take with them. Look at prescriptions, what prescriptions will need transferred. Find a pharmacy where the young adult is going to be living. Those are all important things to know. And again, have that conversation about insurance coverage. Know what facilities they can go to. If they're moving out of state, that may be a whole different ballgame. You need to look into getting insurance with their college or someone, another plan that will have coverage outside of the area.
Mm-hmm. All right. So a lot of details. You just need to sit down and work them out. Just like anything else in life, it's complicated. You need to sit down and talk it out and work it out. Also, once a young person turns 18, the parents automatically don't have information to their medical records anymore, right? In terms of that being automatic, there's a process there.
Oh, absolutely. And that can be a difficult one for the parents to realize all of a sudden they don't have access to their kids' information. We have, even my own son is going to be a senior in high school, and he's going to turn 18 in October. So from then on, I'm kind of out of his medical records unless he gives me permission. So due to HIPAA privacy laws, the parents will have to have written permission from that young adult in order to have access to any of their medical records from that point on. So make sure you talk to your child that they need to add you onto that HIPAA form. But again, it is up to that young adult once they turn 18, who they list on there for emergencies or who can have access to their information.
Mm-hmm. All right, we've got about a minute left, and I'm sure you deal with this every day, young people leaving the nest. And it's probably somewhat of a difficult transition for them, although they're excited in most cases. It's also kind of difficult for mom and dad, right, to kind of let go a little bit?
Absolutely. It's really hard. As I've been on the parent end, I've already had 2 leave, and it is hard. And then transitioning the healthcare side of things is just another layer on there.
Yeah, just something, again, you need to be detail-oriented. You need to think it out. You need to sit down and work it out with the insurance and with immunization records. And obviously, again, with them turning 18, there's a process with the parents still having the ability to access their children's medical records, all the details. Well, Dr. Flower, we appreciate this information. It's been great. Again, you can reach Mon Health Primary Care in Fairmont, 368-2422. Again, Mon Health Primary Care in Fairmont, 368-2422. Dr. Lisa Flower has been our guest. And Dr. Flower, thanks again for your time. It's great information, and we certainly appreciate you joining us this morning.
Thank you for having me on. Dr.
Lisa Flower there. And that's Mon Health Talk for this Monday morning. Thanks for joining us. 104.5 FM, 1440 AM, WAJR.